Hello, good evening. It's great to be with you guys again tonight. Jared Brown, Executive Director of Mission Lazarus. Um, really going to run through a lot of things tonight. A lot has happened in the last month that we just want to uh, let you guys in on and let you guys hear firsthand what's going on. Last time we did a webinar update, there were some folks that had trouble submitting questions, and we figured out that if you're on a laptop or a PC, that will help you be able to submit those questions through the live chat. And Allie is here with me, and she will be passing those questions on to me at the end, and we'll try to answer as many questions as we have time for. So there's been a lot of amazing things happen over the last month. We launched our Neighbor to Neighbor campaign as an official way to be able to respond to some really unique but very strong needs in both Honduras and in Haiti. And the response from you all, from our supporters, really has been incredible. And it's allowed us to be able to do some really dramatic things. And our teams on the ground in Honduras and Haiti have been really busy, working really hard, being, quite honestly, the hands and feet of Jesus during these unique times. I'm going to start off in Honduras. Some of y'all may be aware that the situation, in particular in southern Honduras, over the last probably 45 days, really started to escalate, and the government health system was nearing collapse, was overwhelmed, the hospital was overwhelmed. And with that in mind, local authorities reached out to our leadership, to Luis Brizio in Honduras, to see, in what way we would be, or Mission Lazarus would be able to respond, be able to help out. Luis and our medical director, Dr. Nelsie, put together a plan in about 2 weeks' time, put together a plan, sourced supplies, and launched our program. And our program consists of 3 medical teams, each team with a doctor, a nurse, an evangelist, and a driver, going out with lists provided to us by the Department of Health in Honduras of suspected cases. And our team's been going to the homes of the patients to assess their conditions, and with a complete setup in each of the vehicles, from oxygen tanks, nebulizers, COVID quick tests, and a variety of pharmaceuticals to hopefully be able to treat symptoms before they get bad and before people end up in the local hospitals. And that has been one of the key things, just to take pressure off the local system with the limited capacity. They've really been overwhelmed. As of this past Friday, the numbers that have been reached has been quite incredible. Our teams have visited 551 homes, and of that, they performed 339 medical exams. They've had a total of 211 people be tested for COVID. And of that, there's been 147 negative tests and 64 positive tests. Really, those percentages are quite alarming. It comes up to about 30.3% of positive tests, which, if you've tracked much of the rates in the U.S., that's quite high compared to the positive test rate in the U.S. We've been really thankful that over the past month, up until actually this past Friday, not a single patient had their conditions deteriorate and need to be transferred to a hospital. And we credit largely the fact that we've been able to get medicine to treat symptoms before their conditions got worse. On Friday, however, our first patient was transported to the hospital due to his symptoms and his condition deteriorating. We're really excited because now, due to what we've been able to do medically with our teams, what God is doing through Mission Lazarus is being made known to the entire region. There's now been a total of 4 news broadcasts highlighting our medical teams, and a key part of each one of those broadcasts has also been our spiritual outreach director, Santos Espinosa, who's been there with our medical director and with our national director, Luis Brizio. Local authorities have now been able to acquire resources to be able to hire their own medical teams, which they'll be launching later this month. In the meantime, they've requested Mission Lazarus to train these new teams. And they said that was largely due to the positive patient outcomes that we've had, as well as the clear documentation, the clear documenting and reporting processes that we have, that we've been able to report back to them exactly what the situation is in our region. Many of you all have been praying for Dr. Nelsie, who last month, just as we were launching this program, tested positive for COVID-19 herself. And so that meant that she had to sit out the first few weeks of this new endeavor, but she rested well, and we're really excited to be able to announce that she's made a complete full recovery and is back, as the leader of our medical outreach now. And many of y'all know one of our evangelists, Julio, and he's worked with many groups. And Julio, unfortunately, he's been with our medical team for the entire month. And unfortunately, just today, he tested positive for COVID-19 after feeling ill for a few days. Finally got tested. And so I ask for you guys to keep Julio in your prayers over the next few weeks. I've personally been able to see the images literally daily coming back and hear the stories daily from Honduras of the lives that have been touched by these teams going out into the community, both in the urban and rural setting. And, as much as the impact has been quite remarkable that our medical professionals, our medical teams have been able to have, also hearing the stories of how important our evangelists that are going with each team have been. For so many of these people, there's so much misinformation spreading throughout the region. They really have a lot of fear of what it means to have been tested or to have been tested positive for COVID-19. And so for our spiritual outreach team to be able to be there, to be praying with them and minister to their spiritual needs right in tandem with their physical needs has been a really powerful testimony to why Mission Lazarus is in Honduras in the first place. I want to jump over to Haiti and give you guys an update on what's been going on there. You recall that a couple months ago, we distributed food supplies to all of the families of the children from the Lazarus Academy, where we operate in northeastern Haiti. It was an incredibly successful program, but through that, our director in Haiti, Wilkie Joseph, was really made aware of the overall need far beyond what was just the children and the families that are represented in our school. So in July, we put together a plan to feed up to 1,000 children a day, and we would do that for as long as funding would allow. We estimated that to cost us about $1,000 a day. We put the word out, and truly almost immediately God provided that answer through a very generous donation that covered us for the first month of this program. The children have been arriving, starting on a schedule really based on the village or the community that they're coming from, starting from early in the morning by 8 or 9 o'clock, and throughout the day, all the way up until 5 o'clock in the afternoon. To be able to serve, to cook and to serve this many children means that our staff has truly worked tirelessly. And what they have been able to accomplish over the last month has been remarkable. Just a few statistics on what has taken place. 13,386 children have been fed. Something interesting happened in the first week of this program when a 6-year-old little girl came back through the line to ask to be served again. And she said that she wanted to take food home to her grandmother. And that was something we hadn't considered or hadn't thought might happen. And obviously the answer was absolutely. And with that in mind, Every child that had brought a container and that wanted to take food home to their family, to others that didn't come, were able to do that. Our director, Wilkie, estimates about 80% of the children have taken food home with them. And so that would be an estimated 24,000 meals have been served to individuals based on the 13,000 different meals that have been served over the past month. And that represents seven different villages that were represented from the region that we serve. Last week, the school in Haiti did return to classes. So our capacity to serve meals to children has been dramatically reduced due to the operation hours of the school. But we're going to be continuing this program, although at a reduced level, and meals will be served from about 2:30 in the afternoon until 5 p.m. Speaking of those classes being back in session, this is a bit confusing, but the current classes that are in session in Haiti is in order to finish up the 2019-2020 school year. And that's supposed to finish up over the next 2 months. We're still waiting on confirmation from the government authorities in Haiti as to when the 2020-21 school year will actually begin and what that's going to look like in Haiti. Some of you all might have seen news reports over the weekend of destruction and loss of life in the Caribbean as the hurricanes and tropical storms moved through, in particular across the island of Hispaniola with Haiti and the Dominican Republic. And while there was a lot of damage and loss of life in Port-au-Prince, very thankfully Northeast Haiti, where our operations are located, were spared any damage. There was no flooding or major issues reported, only steady rain. There's a few more things that a number of you all have been following and seen and prayed for and even supported throughout this year that I wanted to give you guys a quick update on. Jose Flores, who you'll recall was in a bad wreck back at the beginning of April. Just today, we published a new video update on his truly miraculous recovery from a broken neck that he sustained in this vehicle accident. If you recall, doctors said that he would never walk again, and his diagnosis was as a paraplegic. Well, he's now walking. He's now feeding himself. He's bathing. He's texting. And after months of physical therapy and trying, today I received the videos of Jose able to actually be able to write and hold a pencil again. We thank so many of you all for your prayers for Jose, and we're really excited about what God is doing in Jose's life, and that this miracle has been a testament to God's true power. Also, our coffee farm, which you'll recall back in April as well, we thought was going to be lost from a wildfire that swept across the mountain. It was not lost, and we praise God for that. It didn't make sense that it wasn't lost, but God spared it. And the rainy season this year has been really steady and a really good rainy season, unlike any that we've had in the past many years, actually. And the amazing women who operate and run our farm have been working diligently throughout the shutdown to take care of this year's crop. And we're really excited that they've been able to keep their employment, and also that this year's crop is looking to be a buffer crop. If you haven't tried our coffee, or if you have and you need to get some more, you can check it out at sanlazarocoffee.com, sanlazarocoffee.com. And if you use discount code webinar, you can get a 20% discount off of your order. Our other non-essential operations in Honduras are slowly starting to open back up. And next week, our vocational junior high and high school will begin having classes again, although at a greatly limited schedule and very different from how it's been in the past. But they'll be starting back on Monday. We ask that you pray for all of those all those children as well as our teachers for their protection, as COVID is still a very real and present threat in southern Honduras. Also, Lazarus Artisan Goods, the leather shop in Honduras, has begun production again, although at a very limited scale. Sales of our leather goods have slowed down drastically during the shutdown in the U.S., but we're very thankful to be able to be operating again, and thankful for some special custom orders that have come in that have allowed some of our team to be able to get back to work. Again, you can check out our leather goods at LazarusArtisanGoods.com, LazarusArtisanGoods.com, and we have the same special for our webinar tonight. Use discount code WEBINAR for 20% off your order. Lastly, I want to say thank you to all of you all again. This season that we've been in, it has not been easy. And truly, your prayers have been a tremendous blessing, not only to Allie and I. We've been, honestly, very comfortable here in the U.S., but your prayers have been a true blessing to our teams overseas in Honduras, in Haiti, who have been on the front lines serving, honestly, the least of these daily since the pandemic was declared. And honestly, it's been the generosity of so many that has not only been a blessing, but has also been a true encouragement to our entire staff across 3 countries. We've been truly amazed at the opportunities that God has provided us to serve and to respond in unique ways that we never imagined. We've been amazed that you've responded the way you have to the level that you have, because it's been your generosity that has allowed us to answer the call from God to serve his people. The response has truly, truly allowed people to know that their prayers and their cries out to God have not gone unheard. And it has allowed these promises to be real for the people that Mission Lazarus is serving in Honduras and Haiti. Are there any questions? Any questions? No questions have come in tonight. So hopefully it wasn't because of technical issues. But we really appreciate you all. And thanks for connecting with us this time. And we hope to see you all again real soon.